Hello everyone, I am Dr. Chandramukhi Thakkar. I am a dentist from India, currently living in the US, and I am preparing to go to dental school in the United States. Meanwhile, I want to share my dental knowledge with all of you so that it can be useful to anybody in need. So here we go. Our first topic is, which is very basic but very important, structure of the tooth. And here we go.
At a glance, a tooth may look like a small white object in the mouth, but scientifically, a tooth is a highly organized structure made of different tissues, each with a specific job. Let us understand it in a simple way. A tooth has two main visible regions, the crown and the root. The crown is the part of the tooth that we can usually see in the mouth above the gum line. This is the part we use for biting, chewing, and speaking. The root is the part hidden under the gum. It sits inside the jawbone and helps hold the tooth firmly in place. Now let's go layer by layer. The crown is called enamel. Enamel is the hardest substance in the human body. It protects the tooth from chewing forces, temperature changes, acids, and bacteria. But there is one very important point. Enamel is not living tissue. Once enamel is lost due to decay, erosion, or wear, the body cannot grow it back like skin. However, very early mineral loss in enamel can sometimes be helped by remineralization, especially with fluoride, saliva, and good oral hygiene. We find dentine. Dentine forms the major bulk of the tooth. It is not as hard as enamel, but it is still harder than bone. Dentine supports the enamel and protects the inner pulp. Dentine contains tiny microscopic channels called dentinal tubules. These tubules help explain why a tooth may feel sensitive when enamel is worn away or when dentine is exposed. For example, cold water, sweet foods, or air can sometimes trigger sensitivity through exposed dentin. Of the tooth is the pulp. The pulp is the living soft tissue of the tooth. It contains blood vessels, nerves, and connective tissue. The pulp helps nourish the tooth during development, helps form dentine, and gives the tooth sensation. This is why deep tooth decay, cracks, or trauma can cause pain when bacteria or inflammation reach the pulp. The space that contains the pulp is called the pulp chamber. As the pulp continues down into the roots, it travels through narrow spaces called root canals. These root canals carry the nerves and blood vessels toward the tip of the root. The very end of the root is called apex. At the apex, there is a small opening called the apical foramen. Through this opening, nerves and blood vessels enter and leave the tooth. Now let us look at the outer surface of the root. By a thin hard tissue called cementum. Cementum is not the same as enamel. Enamel covers the crown, while cementum covers the root. Cementum helps attach the tooth to the surrounding support system. Between the tooth root and the jawbone, there is a very important tissue called the periodontal ligament, often called PDL. The periodontal ligament acts like a natural shock absorber. A tooth is not directly fused to the bone. Instead, it is suspended by these tiny ligament fibers. These fibers connect the cementum of the root to the surrounding alveolar bone, which is the part of the jawbone that supports the teeth. Around the tooth, we also have the gingiva, commonly called the gum. The gum surrounds the tooth and helps protect the deeper supporting structures from bacteria and injury. Healthy gums are important because the tooth is not just a tooth alone, it is part of a complete supporting system. So, to summarize, the enamel is the hard protective outer covering of the crown. The dentine is the main body of the tooth and supports the enamel. The pulp is the living center containing nerves and blood vessels. The cementum covers the root. The periodontal ligament attaches the tooth to the bone and acts like a cushion. The alveolar bone supports the tooth in the jaw, and the gingiva or gum protects the tissues around the tooth. A tooth may look simple from the outside, but it is carefully designed biological structure. Understanding tooth structure helps us understand tooth decay, sensitivity, gum disease, root canal treatment, dental pain, and why prevention is so important. In the next video, we can build on this foundation and discuss how tooth decay starts, beginning with enamel demineralization. Thank you for watching.